News 4's continuing coverage of the coronavirus outbreak. Samantha continues anchoring from home. And Sam, some positive but cautious headlines tonight.
Yeah, Steve, that's right. We heard from Dr. Fauci just a few moments ago, the White House task force expert saying that social distancing, it's working. That's the positive. But here's the cautious part of that. He warns if we stop, then we'll see a big spike in cases. And here's a good picture of why we don't want that to happen. Take a look at this number, 431,838. That is where the U.S. stands tonight in the coronavirus outbreak. Still by far, Steve, the world leader. Deaths are now approaching 15,000. And as we've been telling you, African Americans continue to be hit hard by the virus. The new stats tonight reveal all 12 of the city's deaths were Black, and more than 50% of the cases in St. Louis County are Black patients. Tonight, News 4's Ashley Lincoln is discovering what help is being offered to the African American community. She joins us live from Christian Hospital in North County. Ashley.
Well, Samantha, this hospital has been hit hard with a number of positive COVID cases. Tonight, a doctor telling us that there's no gene here at play making African Americans more vulnerable to this virus, but rather a complex web of both health and social economic issues that are leading to high mortality rates amongst African Americans.
People are getting sick, and they're Black.
ICU Dr. Lori Punch on the front lines, seeing the grasp COVID-19 has on African Americans at one of the hardest hit hospitals, Christian Hospital.
There's young and old. There's healthy and not healthy. It really isn't discriminating. What's discriminating is how they do after the fact.
National leaders announcing Tuesday African Americans are more likely to contract the virus and die. Punch says preliminary stats conducted by BJC show in St. Louis, African Americans are 2.5 times more likely to get the virus and 4 times as likely to end up on a ventilator.
If a virus is a bullet, then your hand is the gun and your sneeze is a semi-automatic. So everyday contact virus is everywhere.
She says the problem is twofold. First, pre-existing health conditions like diabetes, obesity, and hypertension exist in many of the positive patients.
Then once it gets into bodies that don't enjoy a baseline general good health, the virus literally catches people almost on fire.
And second, the disparity of health and economic resources available to African Americans.
You have a segregated population of Black folks who also have a concentration of poverty and structural inequities that don't create access to food, housing, safety, and education the way that it does for the rest of the region.
The app is, again, designed around COVID.
Organizers with the Islamic Foundation of Greater St. Louis are spreading the word about the Home Safe First app, providing coronavirus fighting resources to underserved communities of color.
So in this, they have an easy access, instant access right away to some physician.
And community care organizations like CARE STL just expanded testing sites here in North City. Wednesday, they opened this site located on Annie Malone Drive. Leaders say this site was needed to reach people in the Ville neighborhood who don't have access to transportation.
This disease is not just about any individual. If we have it, we put everyone around us at risk, and we've got to take that seriously.
And in many cases, these are working class communities. So these individuals don't have the luxury to practice social distancing because Dr. Punch says a lot of these people still have to get up and go to work. Now, we will have information on the Safe Home First and where to get testing with CARE STL on our News 4 app. Live tonight in North County, Ashley Lincoln, News 4.